Welcome to This Week in General Medicine. This week we're covering 9 notable papers spanning cardiovascular and metabolic health, maternal and pediatric outcomes, and lifestyle factors influencing long-term well-being. Let's dive in. We begin with a major shift in how we conceptualize and manage cardiovascular risk and heart failure. In JAMA, we see the introduction of the first clinical guidelines for cardiovascular kidney metabolic, or CKM syndrome. This framework recognizes the deep systemic interplay between metabolic conditions, like obesity and diabetes, chronic kidney disease, and cardiovascular disease. By treating these not as isolated comorbidities, but as a unified syndrome, the guidelines aim to promote earlier risk detection and multi-organ protection. This systemic approach aligns closely with another major update published in JAMA, the new Universal Definition of Heart Failure, issued by global cardiology groups. This updated definition seeks to standardize diagnosis worldwide, emphasizing objective evidence of cardiac dysfunction alongside clinical symptoms, which helps clinicians identify and treat heart failure more consistently across diverse practice settings. Also in JAMA, the therapeutic landscape for metabolic disorders expands with the Food and Drug Administration's approval of a new hypertriglyceridemia drug designed to reduce the risk of pancreatitis. For patients with severe hypertriglyceridemia, this approval offers a critical management tool to lower lipid levels and prevent the highly morbid complication of acute pancreatitis, addressing a long-standing gap in preventative metabolic care. Next, we turn to maternal and child health, where new evidence helps guide high-stakes clinical decisions from delivery to infancy. In PLoS medicine, a large population-based cohort study from Sweden evaluated the long-term neurodevelopmental safety of vacuum-assisted delivery, analyzing over 630,000 term singleton births, with a median follow-up of 13 to 14 years. The investigators compared vacuum-assisted delivery to emergency cesarean delivery and spontaneous vaginal delivery. They found that while mid or low vacuum-assisted delivery was associated with significantly higher odds of short-term neonatal complications, including a roughly 7-fold increase in traumatic intracranial hemorrhage, a more than 3-fold increase in non-traumatic hemorrhage and subgaleal hematoma, and nearly double the odds of neonatal seizures, there was no increased risk of long-term neurodevelopmental disorders. Specifically, risks for attention deficit hyperactivity disorder, autism spectrum disorder, cerebral palsy, or epilepsy were not elevated, and there was actually a 20% reduction in the risk of intellectual disability compared to emergency cesarean delivery. For outlet vacuum-assisted deliveries, the risks were even lower, mirroring spontaneous vaginal delivery. These findings offer strong reassurance to obstetricians and families that despite transient neonatal risks, appropriately performed vacuum-assisted delivery does not compromise long-term cognitive or behavioral development. Moving to pediatric infectious disease, a landmark trial. The empirical trial, a multicenter, open-label, randomized controlled trial conducted across 19 hospitals in 6 African nations, evaluated whether adding oral valganciclovir to standard care improved survival in infants living with HIV who are hospitalized with severe pneumonia. Standard care included treatment for bacterial and pneumocystis jirovecii pneumonia. Among 558 infants analyzed, the addition of 15 days of valganciclovir did not show a statistically significant reduction in all-cause mortality at 15 days or 12 months in the primary intention-to-treat analysis. However, in a time-varying effects model, valganciclovir treatment was associated with a 40% reduction in the hazard of death at day 15 and a 24% reduction over 1 year when excluding early deaths within 48 hours of treatment. Crucially, severe adverse events were not increased in the valganciclovir group. This suggests that early empirical valganciclovir may offer a vital survival benefit for cytomegalovirus-associated pneumonia in this high-risk population without adding significant toxicity. In other pediatric preventative news, BMJ reports that expert advisors are recommending that all 15-year-olds in the United Kingdom be offered the meningitis B vaccine on the National Health Service. This recommendation aims to close a critical gap in adolescent immunization, targeting an age group at elevated risk for meningococcal disease and seeking to establish broader herd immunity. Our final theme explores how daily environments and lifestyle factors shape long-term health, alongside updates in neurotherapeutics. In PLoS Medicine, a comprehensive systematic review and meta-analysis of longitudinal studies involving over 112,000 participants examined the long-term mental health impacts of work-family conflict. The authors found that work-to-family conflict was longitudinally associated with an increase in depressive symptoms, burnout, and general mental distress, even after adjusting for baseline mental health and other confounding factors. Similarly, family-to-work conflict was associated with higher rates of depressive symptoms and burnout. These associations held true regardless of gender, geographic location, or the length of follow-up. This robust evidence highlights that inter-role conflict is not just a temporary stressor, but a significant driver of chronic psychiatric morbidity, underscoring the clinical importance of screening patients for occupational and domestic stressors. Nutritional factors also remain at the forefront of preventive medicine. A study published in the BMJ from the Nutrinet Santé Prospective cohort investigated the association between the consumption of ultra-processed foods and cancer risk. The findings reinforce the growing clinical consensus that diets heavy in ultra-processed foods are linked to an elevated risk of developing overall and site-specific cancers, providing further ammunition for physicians advising patients on dietary modifications. Finally, in neurological therapeutics, the BMJ reports on the Food and Drug Administration's approval of easier initial use for the Alzheimer's drug lecanemab, a decision with major clinical implications globally, including for the United Kingdom's healthcare system. This regulatory update simplifies the initiation protocol for this amyloid-targeting therapy, potentially broadening access and streamlining the delivery of care for patients in the early stages of cognitive decline. If you only have time for one paper this week, make it the Swedish cohort study on vacuum-assisted delivery. This study addresses a long-standing clinical anxiety by providing high-quality, long-term reassurance that while vacuum-assisted delivery carries transient neonatal risks, it does not elevate the risk of major neurodevelopmental disorders like ADHD, autism, or cerebral palsy over a 14-year follow-up. Here are the key takeaways from this week in general medicine. First, when discussing vacuum-assisted delivery with obstetric colleagues or concerned parents, you can confidently share that appropriately performed vacuum extraction does not increase the long-term risk of neurodevelopmental disorders such as autism, ADHD, or cerebral palsy, despite known short-term neonatal risks. Second, in infants living with HIV who are hospitalized with severe pneumonia in resource-limited settings, consider the early initiation of empirical valganciclovir. The empirical trial suggests it may significantly lower early mortality risk without increasing serious adverse events. Third, recognize work-family conflict as a formal, longitudinal risk factor for depression and burnout. Incorporating brief inquiries about work-life balance into routine mental health assessments can help identify patients at risk before severe symptoms manifest. Fourth, familiarize yourself with the newly established cardiovascular kidney metabolic, or CKM, syndrome guidelines, which advocate for a unified, multi-organ approach to risk assessment and prevention rather than managing diabetes, kidney disease, and heart disease in isolation. And finally, counsel patients on the long-term health benefits of reducing ultra-processed food consumption, emphasizing its established link to increased cancer risk, as demonstrated in large prospective cohort data. That's your roundup for this week in general medicine. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.